Welcome to PharmaSource. I'm joined on the podcast today by Ray Sisons, Managing Partner for SCxCMC, a consultancy that connects biotech companies with highly qualified CDMOs, strategic consultants, and independent contractors. Ray typically works with emerging and clinical stage biotechs in North America, often without a supply chain function. In this conversation, he talks about his outsourcing process and shares advice for how to make partnering work better with CDMOs and the supply chain. As a starting point, Ray, I think it would be great to just understand a bit more about you and your background, because you're obviously a CMC consultant. You've been working for, according to your LinkedIn profile, 25 years plus in emerging clinical stage biotechs.
Yeah, that's right. I like to say that after 25 years, you kind of stop counting. But I did sort of start out back in the early 90s at a company called American Cyanamid in Pearl River, New York. My claim to fame there was that as Al Gore invented the internet, I invented cleaning validation. So as a young engineer right out of school, I was tasked with helping American Cyanamid address 43s related to cross-contamination. And out of that came the first cleaning validation program, which I worked on with, it wasn't just me, it was a team of really, talented engineers and thought leaders, Ed Eisenzoff, Loretta Harrison, Syed Sharfuddin, and we put together a good program. It's basically, to this day, it's sort of foundational to have how everybody does cleaning validation. So I'll just wrap up all of my engineering technical background with that. And just jump forward. I was my last salaried job was about 12 years ago. I was selling services for Patheon, and quite simply, I just saw on that side of the table.
That was pre-acquisition, presumably.
Yeah. So this is 2010, 2011, before the Thermo Fisher. I was selling services for Patheon, and it was quite clear from where I was sitting that the folks on the other side of the table just didn't know how to. Many, like I said, clinical development stage biotechs, these companies that are early on, they don't have formal procurement, they don't have formal supply chain functions. So they would just be foundering when it came to, how do I outsource? There was just, I saw very often not a very structured approach. And so I thought to myself, hey, you know what? I could probably, do more, create more value by helping them outsource. And from that, I designed sort of an outsourcing process that was really, kind of selfish. It was directed at the business development guys on the other side. It's like, what information do they need? How does the selling process line up with the buying process? What we now call the seller's journey and the buyer's journey. And back then it was just a sales funnel. But how could I help these guys help themselves by promoting their projects and and being able to communicate effectively with the business development teams at the CDMO.
So talk me through that then, Ray. What does that look like? What are the two customer journeys, and how do they differ, and how do they need to be better aligned?
So I'll start with the buy side, since so what I developed was a vendor selection program, and at this point, most companies should have an SOP on vendor selection. But if they don't, it's a good place to start. How do you actually do this process? And from the very beginning, it is project definition, really setting your priorities, knowing what it is you're trying to outsource, understanding where you are in the business cycle, and what's your exit. So, if I'm talking to a client and they're looking for a commercial supplier or a one-stop shop, and they have a rationale for that, well, that makes sense. That's very different than, a biotech that just needs to get prototypes done, maybe some preliminary stability work, So depending on what the scope of the work is, it sort of depends. It informs your priorities. And it also depends on, the team. It's important for these guys to understand that it's not just maybe the scientist at the bench that has the final say on who you outsource to. You really do. You need to talk to your quality folks. You need to talk to your compliance folks, the regulatory guys. And if you have that function set up already, you should be talking to your commercial and supply teams. What are their objectives and what do they need to do? So, bottom line is you need the right team, you have the right voices at the table, helping you set priorities and what ends up being selection criteria. So that's on one side. And the selection criteria obviously is going to be operational, technical. There are going to be quality components, obviously the business piece. But there's always that sort of that, I call it intangibles. So there's the intangible quality of things. You can't measure them, you can't score them. But things like corporate culture, like leadership quality, things like, might be geographic location, that it doesn't really fall into any of the technical categories, but at the end of the day, these are the things that make a difference.
On those points, do you feel that geographic selection is becoming more important now since everything that's going through the Senate and similar policies going on in the EU as well about reshoring and bringing everything close to base? Are you seeing that in your work as a need?
Much more on the commercial side, and I think it's a good effort. I like to think, and I still hold this to be true, is that when you're in supply chain, it's the uncertainty is the problem. Like, as long as we know what the rules are, as long as we know what how the table's been set, we can work with that. And I know that there are trade-offs, and there are things that, especially the IRA, the Inflation Reduction Act, which I think you're referring to, that are not entirely positive for industry. But it is what it is. If those are what the laws are going to be, then, from a supply chain perspective, we have to work around them and find out what works for us. And what works for the CDMOs, like what's best for the company and where we have to find workarounds. So I think that's how I approach it.
When it comes to that point around cultural fit and making sure that you've got the right leaders who are around that table, what's the good and the bad and ugly of that? Have you seen cases where leadership just failed to get on?
Well, I think that in every article and every discussion on CDMOs and their sponsors, it always comes down to communication and relationships. So those are two things, again, intangibles. Communication and leadership. Like, how, where do you put them in the spectrum? How do you score that? In the selection process, it's something that really develops over time. So I think that we always work on those types of things. And as an engineer, as a scientist, you break it down. You don't just say, oh, well, it's communication and then set it aside. I've seen many of the large pharma companies, because communication is important. There's many people. They have very sophisticated approaches to doing project and program management, governance, escalation, etc. And those are some of those best practices where they apply and where they can be scaled properly, scaled down to a biotech. I think that's important. And it's also important that the CDMOs have well-structured project management teams as well. And I'd just add to that there should be sort of a correlation, right? There is a project manager at a CDMO, but that does not relieve the sponsor of the responsibility of having their own internal project manager, because the CDMO is not going to have the full context of our project. And there's going to be a lot of things that happen in the development cycle that are outside the scope of what the CDMO has to do, but impact the direction of a project. For example, you may change wording in a clinical, the wording of the indication in a clinical study. Therefore, you might change the clinical protocol. If the clinical protocol changes, then that could change everything from the dosage form to the dosing schedule to the the demand, and they may have to be packaged differently. So there's a ripple effect that happens when we make these types of changes, and it's not going to be apparent to the CDMO. This is what I like to call, or we started calling, surprises.
Yeah.
So when you end up everything always starts off very on the best foot, right? Everything, when you kick off a project, everything is lined up, you've defined everything, until you get punched in the face, right? Until you see that first surprise, and then you have to react. There are good surprises and there are bad surprises.
That's also the nature of science and pushing the boundaries of chemistry, isn't it? There's always going to be experimentation, risk, and failures kind of baked in as part of it. Yeah,
the term that that is in vogue right now in supply chain is resilience. The ability to react to surprise, the ability to react to changes in a given plan. And I think that it's apt. It's an appropriate word. I think that CDMOs have to be resilient. They have to be able to react and change. But when they don't, then you have that. That's where the communication, the governance come in. We have to escalate. We need to get people involved. We talked about leadership. Right. So leadership and corporate culture, what is the culture of a CDMO? Does it line up with the culture of your company? And does that allow you the ability to work together on things, or does it erode trust? And if you erode trust, then things can escalate in non-positive ways very quickly.
Yeah. What advice would you have for people who are trying to manage that risk and make sure there aren't any supply chain disruptions? I mean, would you recommend having a number of CDMOs on the go at the same time? I mean, what's the best way to try to mitigate that risk?
For many smaller companies that are in my client base, like having multiple CDMOs is not really economically viable. Having a backup, but it brings up an important point, which is, when is it time to change? I think most of the work that I do is like a certain level of frustration is reached, and whoever's to blame is not the point. The action is, help us find an alternate. We no longer want to work with this company. And I had this conversation recently with one or two other consultants that have been in the same position. The question is simply, when is it time to cut a CDMO loose? That's not a comfortable question to ask in the presence of CDMOs, where the leadership team is like, no, we have to work this out. This is important. It's a partnership, and it is and it isn't, right? It's a transaction. It's a business transaction. If one side fails to deliver, and does not meet its contractual obligations to the services that they have contracted to provide, that's a red flag. So we talk about red flags. Like, what are a couple of red flags? Certainly not meeting the deliverables, not meeting the timeline. Things happen, and so we want to use all the project management and business tools that we have at our disposal before we look at the contract and start taking legal action. Or if we simply, there should be an exit clause. There's typically one where you can get out for cause or, without cause.
When you do get called in on a project, do you often find it's correctable? Like you can get the process back on track?
Here's my observation. The red flag is if the two sides or one of the sides is no longer negotiating in good faith. And see, that sounds like a legal term because it kind of is. That's the language we use when we're looking at contracts. That means that we've gone to the contract now. We've gotten to the place where both sides or one side is fed up enough and is frustrated that they're looking at the language of the contract to see what they're supposed to do. Like in a functioning relationship, you don't do that. You pick up the phone, you call them, and you figure out a way to work it out. But if I see, or if it's evident that one of the parties is not acting in good faith, not negotiating, not looking to actually solve the problem, I think that for me is the moment when you decide we need to look at our backup. And so you talked about having multiples. As part of the vendor selection process, I always recommend that you have a primary and you have a backup. You negotiate with the primary. Obviously, you want to move forward with them. But if things go sideways, you should always keep a relationship with the backup, even if you don't contract with them. Does that make sense?
Absolutely. Ray, sat where you are, you must see a real cross-section of biotechs at clinical, emerging stage. Be interested just to sort of check the pulse, really. How do you feel that the market is right now for biotechs stateside?
In my small microcosm and my sort of unofficial sources of information, the companies that need the cash are getting the cash. There are investors out there that are actively looking for investments. Of course, they're being a lot tighter, and perhaps my experience now, having been through a few startups and supporting startups, I really like the old meme that it really comes down to leadership, and being able to recognize strong leadership. I think that those companies that do demonstrate that they have good leadership in place, access to the right advisors, they're getting funded. So there's that. Plus, I believe that on some of the lists of companies that are getting funded versus those that no longer pick up the phone, I think there's still more companies being funded than are being delisted. As in, like, no one's following them or you can't find them anymore.
The ones who are successfully getting funding at the moment, are there particular areas which are hot for investment right now?
Now, that's a great question because, as in procurement, in the work that I do in CMC, we almost don't look at the modality. If that sounds crazy, I mean, yeah, it is important, but I can say that oncology, obviously, like a lot of the folks I know that are working in oncology, there seems to be a lot of energy in diabetes, obviously, but it just sort of, I think there's been a lot of talk about insulin and caps on insulin prices, but there still seems to be a lot of activity there because, again, anytime there's a disruption or a change, there's a market opportunity. And if the leadership of some of these companies that have IP or have ideas can articulate that well to the investor community, that they're getting funding, and I'm seeing that.
It's a huge market to crack, isn't it?
Yeah. And then of course cell and gene therapy, which I think is another interesting area that I've seen a lot of people invest a lot of time to understand because it is so new. And whenever I cross paths with projects in cell and gene therapy, it is amazing how it's just an entirely different paradigm, not just from the modality standpoint, but also in supply chain, and how how we talk about, what vendors are available, what capabilities are needed, and the list goes on and on.
Well, including regulatory as well, of course. So a lot of companies that seem to be getting stuck in the treacle at the moment with cell and gene therapy, and the FDA, I don't think is quite there yet in terms of all the different regulatory approvals. Are there ways that companies can avoid getting stuck at that stage?
I think that it's similar to any emerging technology where the technology is going faster than the regulations. And also when it's new to everybody, like the regulators have to be educated in this space, on this modality as much as anybody else. And staying on top of that, I think is very challenging. Like I know a lot of the folks at the FDA, they're just regular people like you and me. And, as new technologies, new ideas come up, they sit in an interesting position, right? They get to see an aggregate of all these different companies coming to them with ideas, wanting to talk to them about it. So they have a breadth of experience and knowledge in these discussions, but not a lot of depth because, these are fields that are new. Many of them have educations like me, where I went to school in the 80s and 90s, and many of these fields didn't exist. There's no I have no educational background to really talk about this other than what we've learned on the job. And I guess I can say I learned, like most people, I learned all of my supply chain principles on the job. It wasn't something I went to school for, and it didn't exist as a discipline until more recently.
It's such an interesting area. Could you tell us a bit more about SCxCMC?
Yeah, it is new, but I've been consulting now for about 12 or 13 years, and my partner Kevin Bidorf, my business partner, has been consulting for 5 or 6 years. He's great at early formulation development, what I was trained to do, but I moved away from very early on. He's still great at doing prototyping, being able to set critical quality attributes, TPPs, target product profiles, and be able to build on that with a lot of great ideas. And there's like I said, my education, my experience in the lab goes back to the early 90s. So there's so many different techniques, so many different processing, so many different functional excipients that are available now that I couldn't keep up with that. But I've always lived at that intersection between CMC, that early product development, and scale up, registration batch, process validation, product launch, launch readiness. And so that's where I wanted to bring a lot of the late stage development expertise and that transition from CMC to supply chain to a lot of the CMC folks, because a lot of the smaller biotech startup companies don't have a formal supply chain function, and they ask a lot of their CMC folks to take that role on. And it's a role that many PhDs I know that spent several years in post-grad learning about a certain thing. It's a discipline they're not interested in. Right? The idea of procurement, logistics, distribution, all that, that's not what why they came into the industry. And that's fine, because there are a lot of other professionals out there that have that discipline, and operating in an environment, a regulatory environment that's more commercially focused, is also something that a company has to pivot towards as they move towards product launch. So that's kind of where there's a combination of putting those two things together, supply chain, CMC, and also having the diverse skill sets that both serve the CMC, the development work, as well as the supply chain expertise.
Would you be able to give an example of the type of project that you work on, please?
Sure. So company has never commercialized a product. They have a project in phase 3. They don't have a supply chain function. So, right now or at least at the time, they had several of their development scientists managing CDMOs. It's a virtual company. So they're managing several CDMOs without a formal supply chain strategy. Mm-hmm. So we have this saying that there's the supply chain you launch with, and then there's a supply chain you actually will use in commercial, day-to-day commercial operations. And so it's, what I see is or what we arrived at was a cobbled together set of CDMOs that may or may not have had the proper commercial skill sets or capacity to meet the long-term forecast for the product. Mm-hmm. So first, there's the procurement piece. Well, first there's this, this is classic, SCORE model. First is supply planning and understanding what the forecasts are going to look like, 3-4 years out post launch. Then there's the procurement phase of going out and finding the correct CDMOs that align with the business plan and the supply chain strategy that is informed by the business plan. And that may be that a company is looking to exit, after launch, or it may be that they're deciding to go it alone and run their own supply chain. So those are other things that we talk to our clients about and use that to develop a supply chain strategy. And then there's the actual tech transfer, manufacturing, product launch, launch readiness with the labeling requirements. And so we work through that. And then we would add to that, of course, serialization, because now the DSCSA requirements. Now, again, these are the things that the people in the CMC group, the development teams, are not going to have any visibility or awareness of. But as you move towards launch, all these factors come into play. And of course, when you move to, closer to launch, then finance gets involved a lot more, right? So you have a much more straight line between your operations and finance, because you're tying up all this capital in inventory, process validation, 3 batches. You've got multiple strengths. You've got multiple batches. That's a lot of capital being tied up.
Yeah.
So, those are kind of in my more recent experience, as a consultant, I've become fascinated by supply chain. Whereas I used to be fascinated by the science or the mechanisms of actions, dissolution rates, controlled release. These days, it really is supply chain strategy, especially coming out of the pandemic, where just the lack of one component completely would gum up any supply chain, and it led to shortages of all kinds of products. And so untangling those types of problems and looking for solutions, I think is right now intellectually very interesting to me, and where I set my where I'd like to put a team together to really focus on solving those problems for our clients.
Ray, it's been fascinating speaking to you. Thank you so much for your time.
Oh, fantastic. Thank you. Thanks for having me.
For more insights and best practices, head to pharmasource.global and sign up as a member. Thank you for listening.